How's it going?
All right, so welcome everyone. It's nice to see people in public health that I haven't actually seen before, because I see a lot of the same people over and over again. My name is Matt Ruther. I'm an assistant professor in the Department of Urban and Public Affairs here at U of L, and I'm the director of the Kentucky State Data Center, which is a Census Bureau affiliated center that sort of helps people get data. So, and mostly the focus is on census data. But I have been doing some research recently on LGBT, really LGBT health, with a co-author of mine. And so I've sort of gotten interested, because I'm broadly interested in data, in where we get data on LGBT populations. Historical data, current data, and what the different sort of variables are that we can use to identify these populations and identify health disparities or health behaviors in them. So I'm going to talk today about four main data sources. Some you may be familiar with if you work in public health. Hopefully I'll introduce you to something that you are not familiar with, so you can learn something. One thing that I will not be talking about today is data that comes from non-health related data on LGBT populations. So I'm talking here about census data. So if you are aware or not aware, the U.S. Census does not ask questions on sexual orientation. It never has. I would expect that it probably never will. The only way that we can identify lesbians and gays in the census is through the question on same-sex unmarried partnership. So we can identify when a man says he's in an unmarried partnership with another male, the census identifies this as a same-sex partnership at present time. Historically, there was some question about what to do in these cases because this question was not set up to identify same-sex couples. It was set up to identify opposite-sex couples that weren't married. And sort of this just came out of it naturally when some researchers discovered that people were actually doing this. And since the same-sex marriage, since the Supreme Court decision this year, the way that the Census Bureau tabulates these responses, it's probably going to change. Historically, when a man said he was married to a man, or a woman said that she was married to a woman, they would recode that as unmarried, because marriage was not legal nationally. And so the way that this is done now is going to change. But I think it remains to be seen what's going to happen with that. In any case, other than what I just said, I'm not going to talk about that today, because the census doesn't have any other additional information on these health-related information on these individuals. And so the four sources I'm going to talk about today are the NHANES, National Health and Nutrition Examination Survey, the National Health Interview Survey, the BRFIS, the Behavioral Risk Factor Surveillance System, and the National Survey of Family Growth. And then if I have time, I'm going to talk about a paper that I'm working on health behaviors, access to care among LGBT populations. So NHANES is a program of the National Center for Health Statistics run through the Centers for Disease Control. In fact, all of the surveys I'm talking about today are all run through CDC in some form or another. And NHANES has been around for a long time. It started in the early 1960s. In 1999, it turned into from the early 60s to 1999, it was sort of sporadic. In 1999, it became a continuous survey, and it's in 2-year cycles. So when you're looking for NHANES data, you'll see data for 1999 and 2000 pulled together, 2001, 2002 pulled together. And that's how all of the data from NHANES is released. Data on sexual orientation and sexual behaviors have been available since this switch to a continuous program. NHANES asks 2 different questions that allow us to identify lesbian and gay and bisexual populations. The survey is approximately 5,000 people per year, and so a given data set from NHANES will have about 10,000 individuals in it. The way that they do their sampling is sort of it's a little bit of a black box to me. They do some sampling framework and then pick 15 counties and then go to the counties and interview people within those 15 counties. It is designed to be nationally representative. if you would like to know more about it, I suggest you read their voluminous methodology on their sampling framework. And NHANES is unique in that they do interviews, questionnaires, which almost all surveys do. But NHANES also does examinations. So they do medical, dental, physiological measurements, anthropometric measurements, and they do lab testing. So they test people's blood. And this is really important in the context of health because sometimes people may not know that they are not healthy until they have a lab performed. And if they don't have access to care, then this could be sort of their, I'm not going to say it would be their care, but it would be their indication that maybe there's something that's not right. And so it's more of a less biased measure of someone's health than you might get from asking them how healthy they are.
I just wanted to ask a question about that. What's the compliance like? Because obviously it jumps into my head to think that the people who don't participate might not be random.
That would be what would jump into my head also. But they claim that they are representative. Okay. They may not be random. They claim that they're representative of the population.
Thank you.
I don't know. There are obviously missing data in all of these data sets. I assume that a person that was selected for this could say, I don't want this particular test or whatnot. This is just an example of the NHANES van that they bring to the community and have people come in and do the testing. Obviously, all of these data are confidential, considered confidential. They do make them publicly available, de-identified. So NHANES, since 1999, has asked people questions on their sexual behavior. And the age group that they asked this question for is age 20 to 69. Prior to 2007, they asked this 20 to 59. And so you get a little bit of a difference in the age group that you're looking at if you look at the before 2007 data. And you also are missing any people older than 70, which, in some points in time that would be fine. As people start to live longer, then 70 may not be a particularly good cutoff. And especially in the lesbian and gay population, less likely to be married, less likely to be cohabiting, may have more issues at that age than heterosexuals. The exact questions that NHANES asks varies a little bit, but basically it's something like, in your lifetime, with how many men have you had sex? The wording changes a little bit, but this is essentially what they're asking. They also ask a question on sexual orientation, and this follows the question on behavior. And they ask, do you think of yourself as heterosexual, homosexual, bisexual, something else, or not sure? And the fact that they ask these something else, I'm not sure, give these something else, I'm not sure responses is really important. Because when you're conducting a survey, what you allow people to answer really may dictate what your answers are. You'll see in some of the other surveys, they don't give these other options. They don't ask, you don't get to choose something else or not sure. And so this should just be something that's kept in mind when you're trying to think about who is answering something else, right? And NHANES has sort of addressed this. They note that these categories, something else and not sure, while we may be prone to say, well, these people are probably bisexual or something like that, because if they're not sure, then they're probably experimenting. You can come up with some theories behind why they would answer that, but it turns out that NHANES suggests that people who are actually heterosexual may say something else because they don't understand the question. So maybe a non-English speaker would not understand what is being asked. So you have to be really careful with these extra categories. Yes, Susan.
So the way that they ask these two questions specifically would only be to men versus, and they'll change the gender up for when they ask the questions of women?
Exactly. Yes. Okay. So I'm just showing you what they would ask the men.
Okay.
And then for the women, they would say, how many women have you had sex? And then they would change gay to lesbian.
Okay.
So this is what the sample looks like, going from 1999 to 2013 for the sexual orientation question. And so you can see the top row here is the The heterosexuals, obviously the largest part of the sample. And then the gay bisexual sample is these 2 lines here. So one nice thing about NHANES is that we have this sort of trend data. So we can see how this has changed over time. One thing that's fairly striking is that these are really small numbers. So in the context of the whole population, they're actually not that small. They're about 2 to 3% of the population, which is what we would expect. But in the context of doing analysis on this sample, these are fairly small numbers to analyze, particularly if you're trying to break this sample down by race or ethnicity or income or something like that. The behavior question gets a lot more responses. A lot more men that we would, and this is just men that we would perhaps identify as gay or bisexual that don't identify themselves as such. So you can see that about 4% of the population gay bisexual, but a little more than 5% has sex with men. Okay, so we have 2 different ways of looking at the population here. We can look at behavior, we can look at self-identification. Among women, we see actually smaller lesbian populations relative to the gay men, but larger bisexual populations. And among women that have sex with women, this number is even higher. So approximately 7% of our sample, these are referring to 2013, 7% of the sample identifies as lesbian or bisexual, but more than 8% has had some sexual relationship, has had some sexual encounter with women. So the benefits to NHANES, like I said, we have multiple years of data, so you can pull data over years, as long as you sort of assume that the relationship that you're looking at is not changing over time. Maybe a good assumption, maybe not, but you can pull multiple years of data to get your sample size up. Past questions both on sexual identification and sexual behavior. This is really important in identifying health behavior risks, because men who have sex with men who don't identify as gay may be a very distinct group here. They may be more, they might possibly be engaging in higher risk behavior, and there may be some related, maybe mental health things that might be considered. Very complex sampling framework. The estimates are nationally representative, although, as we've ascertained, they may not be random selection. And it's the only survey that has this examination and the lab testing, which is, I can imagine, I don't actually do any research on sort of medical type stuff, like I would consider that. But I can imagine that would be a really important thing to have for some people. Limitations, well, we have relatively small samples of the population. These alternative identification options, the something else, and this don't know category sort of muddy the waters a little bit. We don't know where to place these individuals. There's no geographic detail. This is the whole United States. They don't give any identification lower than the whole country. So we can't look at individual states. Not that it would be that helpful, because our sample size would be 1 or 2. Although there is some access to restricted use data, which I'll talk about at the end of the presentation. And there's some limitation on the age group here. So older LGBT populations, older LGB populations that are older than 70, we're not going to be able to identify here. So that's NHANES. Anyone have any questions so far? Am I talking too fast? Okay.
Yes. Of course, you have to, and I understand it's a survey. What I'm going to say is, giving a person a choice to answer the questionnaire as male or female is in itself problematic. Mm-hmm. And is there an option, or do they have an option that the person can indicate discomfort in identifying one or the other?
Not in NHANES.
Okay, that's just something to cover.
Yes.
Thank you.
There are other, well, we're going to talk about one right here.
Okay.
So all of these surveys, they all are surveys. They all have they're all slightly different. And how they're different is sort of what we're trying to tease out here. So the BRFIS is, again, sponsored by the CDC. It's administered by the individual states. So every state has a BRFIS coordinator. The states carry out the survey. And then the CDC aggregates the data and makes it available to the public. It was started in 1984 with maybe 15 states. Not all of the states were participating at the beginning, but by 1993, all 50 states are participating, as well as most of the U.S. territories. And data on LGBT populations first became available in 2014, kind of. So I'll talk about that in just one second. It's a phone survey. It's always been a phone survey. If you have any experience with surveying science, you'll know that phone surveys are problematic because you get a very different sample than you would if you were going door to door. Cell phones were first added to the BRFIS in 2011, and while this is great because now we have cell phones and a lot of people don't have landlines, it's also makes the sampling much more difficult because we can't sample geographically. Landlines are geographically specified. Cell phones are sort of everywhere. Right? You could be anywhere and have whatever area code you want. It's a gigantic survey, approximately almost 500,000 people per year in 2014. And the BRFIS is carried out. There are several sections. There's a core questionnaire that all states are required to answer, and they have to answer it like it's given. And within the core, there are questions that are asked annually, and some that are asked biennially, and some that are asked every once in a while. So that doesn't matter for us because sexual orientation is not part of the core. There's many optional modules, probably 30 to 35 optional modules, and states can do the optional modules if they so choose. And one of the optional modules, as of 2014, is on sexual orientation and gender identity. States can also add their own questions. And this is good for LGBT researchers because some states have in the past, prior to the implementation of this module, have asked questions like this. However, when states ask their own questions, the CDC does not aggregate the data. The data is only available from the individual state. So, for example, the state of Washington has been asking about sexual orientation throughout the 2000s to the present, but you won't find that in any of the data because it was the state out of the question. So you would have to go to the Washington State Department of Health and get their original data. And the BRFIS includes the same topics that most health surveys would include: risk behaviors, chronic health conditions, use of preventive services, and, of course, demographic information. So this map shows the distribution of states. There are 19 of them that did the sexual orientation and gender identity module in 2014. It's fairly geographically dispersed. And like I said, there are other states, Washington, for example, that did carry out these types of questions, but they're not aggregated with the other data because they were added by the state themselves. This is really, this is nice, but it really means that you have to really check each state. So there's no sort of way around that because the CDC does not say these states ask additional questions and these are the questions. You have to figure them out yourself. So the sexual orientation question on the BRFIS is very straightforward. Do you consider yourself to be straight, lesbian, or gay, or bisexual? Same question is asked to men and women, and then you can see that there's no options for something else. There's always an option on any survey to refuse to answer, but that option is not sort of promoted within the question. So the samples, this is from the 2014 BRFIS. You can see the very large sample sizes here. These are only samples. This sample only includes individuals that took the sexual orientation module. So it's not the whole 450,000 people. It's about maybe 150,000 people. But you can see that our samples of gay and bisexual men and lesbian and bisexual women are much, much larger here. And this is 1 year of data, so we don't run into problems of data pooling. You can also see that there are fairly sizable numbers of people that either say they're not sure, refuse to answer, say they don't know, and this is without even being offered that as sort of an option. So again, we have a problem of how to classify these individuals. These percentages of the total weighted by the Berthus sampling weights show that about 3% of both the male population, and 3% of the female population identify as lesbian or gay. Berthus also, following the sexual orientation question, asked the question, do you consider yourself to be transgender? Okay, so you could, in theory, although I did not do this, cross-tabulate this answers to this question with the answer to the previous question to see if those individuals that are saying something else, not sure, are actually transgender. I don't know that, but it's a good likelihood. Very interestingly, to me anyway, they follow up this question with a question on what type of transition the transgendered individual had. So they ask, if the person answers yes, do you consider yourself to be transgender? They then ask, do you consider yourself to be male to female, female to male, or gender nonconforming? This is the only survey that I am aware of that asks this particular question. And this is potentially a very useful question. So I don't know anything about the transgender population, to be honest with you. I never really have. But these percentages are much higher than I would have expected. We see about 0.5% of the male population, slightly less of the female population identify as transgender. And you can see that the distributions, there's a little bit of confusion here. So you have men that are saying, yes, female to male, so you might presume that they are at the end of the transition. You have men that are saying male to female, you might presume that they're starting the transition or they still consider themselves male. So certainly not a panacea and as far as explaining what's going on, but certainly an interesting point an interesting thread to pull at. Yes?
They don't ask about behavior in this one.
They do not ask about behavior.
That's unfortunate.
Yes.
Yeah.
Would gender non-conforming be like they feel that they fall somewhere on the spectrum, just not in like the complete like binary of male female, or
It could. They don't ask any additional probing questions like what does that mean to you. They just ask gender non-conforming. So
I was wondering because I don't know much about like the transgender. Like,
yeah, I sort of feel like maybe the people that are writing the questions may not either.
Okay.
So
That's what I was wondering from the questions.
yeah, they may
You
not.
don't know
I mean,
exactly what answers we're looking for or what answers we're
right,
not.
and this is the first year that it's been on here, so you can expect that in coming years that it will change.
I kind of like the question just because so many people don't identify the trans community as like going from one binary gender to another. Yeah. Like you said, there are people who kind of find themselves somewhere on the spectrum of just gender non-conforming, not necessarily male or female. Yeah.
I mean, ultimately,
it captures more people, I think, than just people going from one binary category to another.
It seems to show, and I don't know if this is the real trend, the much higher percentage going from male to female than the reverse. Is that true generically in the...
Yeah, although
okay.
historically we are seeing more females than male trans people. Like those numbers have been going up.
They're going up.
Yeah.
But how do you know that?
From other,
I mean, you know what I'm saying? Like,
yeah.
just out of curiosity, like,
I will tell you how she knows.
okay.
We'll get to that.
Okay, that's what I keep asking. Like, I love this. Here's education. This is
Yeah. So, do you think
Right,
there's
right.
choices being made or opportunities being missed? Do you think they're choosing to not ask these questions, or, like you said, is it?
You mean historically?
No, here, this data source. Are they choosing to not ask the questions that we're all talking about right now, or do they not know that those questions exist?
I couldn't answer that.
Okay.
I would expect that these are probably some of our countries. I mean, these are not. They don't pull people off the street and say set up a survey for us. These are people that know how to do surveying. So I would expect that they bring in people that would know more about something that they don't know about. I mean, we're talking about a survey that asks this really broad. I mean, there's all kinds of things that are asked about, and no one's an expert on everything. So I would expect there's some sort of committee work that And there's always some political simmering beneath the surface of this. I mean, there's a reason that we didn't have sexual orientation law before 2014. I mean, so there's always this potential for backlash.
Well, I think it's great that they have, for instance, looking at the male to female. You amongst men, you got 0.4%. Those are people who would soon start out as male and still will say I'm male. And then when you go over to the other side, it's 0.1%, and those are people who started as male and now they're choosing to say that they're female. I just find that interesting.
I think a lot there's more that can be done with this question for sure. I'm going to continue on. So one of the nice things about the Berthas is that because of the size of the sample, it allows us to look at, and because the individual states are actually carrying out the surveys, it allows us to look at state-specific data. And so what I've calculated here are just some lesbian and gay and bisexual prevalence rates across the different states. And these are sort of in line with what we would expect. They range from about 2% in our low state, which is Kentucky, to up about 5%, 5.2% in Hawaii. So these are what we would sort of expect to see based on prior research on the topic. We see higher prevalence in the Northeast, lower prevalence in the Midwest. I don't know what's happening to Ohio. I thought it would be lower. It seems a little high for a state that often, we'll just leave that be. I rarely get very political, so I'm not going to in this case either. So the benefits of the Berthas, the large sample is the primary benefit here. If you pull data across different years here, you could easily do analyses that look at sexual orientation, race, ethnicity, and multiple factors. And the ability to identify the transgender population and the type of transition is unique among the surveys that I'm going to talk about. Finally, we get the state level estimates. This is the only survey that has this really nice geographic detail. I mean, it's not great. It's not county level, but we're never going to get county level estimates of this population. It's just too small. Some limitations: telephone survey. The limitations of a telephone survey you can read about elsewhere. There's a lot of them. The addition of the cell phones helped a lot, but it made the survey design really, really complicated. So if you were to go into the Berthas website and download data, you'll find 8 different data sets for 2014 because some states use cell phone sampling and some do not. And then there's different modules, and then there's the state asked questions. So altogether you have a tremendous amount of data, but it's not all in one data set. We're also unable to identify individuals based on behavior in this particular data. And the coverage starts in 2014, so we don't have any sort of continuing coverage of this yet. Of course, next year we'll have this large sample again. So the third survey I want to talk about is the NHIS, the National Health Interview Survey. And this is everyone familiar with NHIS? NHIS is sort of the primary health survey in the United States. It's the one where when you see health stats reported, they probably came from here. Again, it's a program of CDC, initiated in 1957. LGBT populations were first identified in 2013, so last year, 2 years ago, and we got data again for 2014. So we have 2 years of data from NHIS on the LGBT population. It's an in-person survey, nationally representative, 37,000 individuals per year, and very high response rates for this type of survey. So about 80% of adults that were asked if they wanted to complete the survey actually completed the survey, which is a good response rate. And this total rate, there are some households, adults are nested within households, and some households said no, and so this is the total rate of adults within households. So it does get a little bit worse, but I think it's still a fairly good response rate for a health survey. NHIS has 4 core components. There are households. This is the main sampling unit. Within households, there are families, which are 2 or more related individuals. And then you have adults and children. And the LGBT population is identified in the adult sample. And just like Burfus and Haynes, NHIS asks about health status, self-rated health, health problems, how often you see a doctor, access to care, and health behaviors, smoking, obesity, exercise, and similar. In 2013, when NHIS first started asking about sexual identity, they gave these options, which are the following: best represents how you think of yourself, lesbian or gay, straight, which is not lesbian or gay, bisexual, something else, or not sure. So again, they give these options for individuals to choose. And the breakdowns look very similar to the breakdowns from the other surveys. About 2 to 2.5% of both the male and the female population identifies as lesbian, gay, or bisexual. When the survey was first carried out, when individuals answered something else or don't know the answer, they were asked additional questions. And for both responses, they were asked whether they considered themselves transgender or this whole litany of other things. These responses were tallied, they were never released because of problems or concerns about data quality. So they sort of felt like maybe this wasn't the right way to ask this particular question. And so while they asked it, and you can see it on the questionnaire, the data was not ever released. So my read from this, what I would infer from this, is that NHIS has every intention of sort of identifying transgender populations. They just haven't really figured out how they want to do that yet. NHIS is too small of a survey to give us state-level estimates, but it does give us regional estimates for the different regions of the country. And based on these, we see that there's a higher prevalence of sexual minority, where sexual minority is anyone that is lesbian, gay, or bisexual in the West and slightly in the Northeast. And then there's higher rates of refusal to answer the question in the Midwest. Some benefits of NHIS. It's a relatively large sample. It's much larger than in Haynes. It's much smaller than the Burfus because it is an in-person survey, an in-person interview. You're never going to get the sample size of Burfus. It's just not going to happen financially. And because they have these face-to-face interviews, maybe one of the reasons why there's less sampling and or non-sampling error. It's nationally representative of the U.S. population, and like I said, it's the primary health survey in the U.S., so it's very sort of well-established, well-respected. However, just like in Burfus, we're unable to identify individuals based on behavior here. We only know if someone identifies as a sexual minority. And prior to 2013, we don't have any identification of the lesbian, gay, or bisexual populations, and there's no transgender populations yet. And finally, the geographic detail is also limited. Okay, so the final survey that I'm going to talk about, you guys might not be familiar with, I don't know, the National Survey of Family Growth. I'm a demographer by training, so we use this a lot. I did not really realize how much it asked about sexual orientation or how much you could infer about sexual orientation from the survey. NSFG was first run in 1973, sort of sporadically in different years. It was originally only asked of women because they were really looking at how families were growing, hence the title. So they really weren't interested in men. They wanted to know women, what were your fertility intentions, were you using contraception, and those types of questions. It started in the early 2000s in sample waves, so we have 5-year sample waves. The most recently completed full wave is 2006 to 2010. They're in the middle of the 2011 to 2015 sample right now. And same-sex sexual behavior, same-sex attraction, and sexual orientation were first included in Cycle 6 in 2002. NSFG is carried out through in-person interviews, just like the NHIS. The sexual behavior and sexual orientation questions are administered via an automated computer system. So the person will go into a booth and the questions will be read to them, and they will give their responses to the computer and not to the human. Like I mentioned, NSFG asks questions. It's really concerned with demographic sort of marriage rates and things of the like. So we look at marriage, partnership, cohabitation, sexual behavior, how often do you have sex, contraception, fertility, maternity, paternity. Basically, NSFG is like a really, really nosy person asking you a lot of questions. There's much more than you wanted to know about anyone's sex life than you ever thought possible. There are a lot of questions in NSFG. One limitation, or one thing to keep in mind when you're using it, is that it's limited to individuals that are age 15 to 44. They do approximately 5,000 interviews per year, and although it's nationally representative, it does not have any geographic detail. So NSFG is unique in that it asks a question not only on sexual orientation and sexual behavior, but on sexual attraction. And I'll show you what that means. But first, the sexual orientation question, and the wording has changed a little bit over time. This is how it's phrased currently. Do you think of yourself as heterosexual or straight, homosexual or gay, or bisexual? And if we look at the male and female results, we see somewhat higher percentages here. So we have about 4 to 5% of the males, and almost 8 to 9% of the females are identifying as lesbian or gay. This is almost certainly a result of the restriction of the sample to this younger population. So younger people are more likely to identify as a sexual minority, or more likely to disclose that. We're looking at 3 years of data here. These are our sample sizes. You might expect that by the time this 5-year survey is done, these would be approximately doubled, maybe. And so the samples are not terribly small. They're not as large as the National Health Interview Survey, but they are useful.
It may be helpful for folks to think about, if you ask these questions, how few people refuse. Do you think that has to do with how they were asked through a computer rather than in person? I'm struck by how much lower those refusals are.
I think the reason for using the computer testing is to avoid this sort of, I don't want to say confrontation, but this hesitant or reluctance of people to answer these really personal questions. Although the rest of the questions that NSFG asks are really personal also, so I don't know why sexual orientation, but also, other questions that are asked via the same method include questions about income, which the U.S., you cannot ask people about income on surveys. They go crazy. So the income questions also asked via the computer.
And this is a much younger population, so I think they have less hang-ups about describing where they see them.
Certainly. In addition to sexual orientation, and this is unique among the surveys I'm talking about, NSFG asked a sexual attraction question, which is phrased as people are different in their attraction to other people. Which best describes your feelings? Are you attracted to, you may not be able to see this, they ask males, are you attracted only to females, mostly to females, equally, mostly male, or only male? So this is the only survey that gives us sort of this modified Kinsey scale of sexual attraction. As you can see, there's the men that identify only as that would most likely identify as gay are lower than we saw in the previous survey, and so these different these percentages here are capturing people that may identify as gay, may identify as bisexual, may not identify as LGBT at all. Among women, we see roughly the same thing. Obviously, our female samples, in all the surveys that we looked at, the female samples of bisexuals are much larger. So this is if you were studying female bisexuals, this would be a good place to start. NSFG also asks or infers from other answers a question on sexual the sexual behavior. They ask questions about how many men you've had sex with, how many women you've had sex with after the sexual. Actually, they come before the sexual orientation questions. And so you can infer if an individual says that they have had sex with a male or with a female, or the person of the same gender, then they infer this question of sexual behavior. And we see much higher rates of men having sex with men and women having sex with women than we do of people identifying as such. So in all of these 4 surveys, we sort of get the same picture that behavior is very different than attraction or orientation, and behavior is always higher than attraction or orientation. The National Survey for Family Growth asked this really interesting question to me. It's the only survey that asked this. It asks, in the last 12 months, has a doctor or other medical care provider asked you about your sexual orientation or the sex of your partner? And this is really an interesting question to me. There's all kinds of problems with it because we don't have any idea if these people maybe have not seen a doctor in the last 12 months, which is why they're saying no, or if they have seen a doctor and people are just not discussing this. If you can't see this, the people that are saying yes is about 17%, and about 83% say no. This seems really small to me, that if there is in fact some increased risk for poor health outcomes among this population, that this would not be something that they would feel comfortable discussing with their doctor. And it certainly suggests a role of the healthcare system in sort of minimizing those risks.
I mean, I agree with your point you're making, but I'm thinking about most of the people who would be asked the question would have a longer relationship with their physician, and so this question wouldn't come up with my physician because I've been there long enough. You see what I'm getting at? In 12 months.
I see. Yes, I see what you're saying. This would maybe only be relevant if it was your first visit to that.
Yeah, that's where I'm coming from.
Yeah.
Really?
You have another.
Because my physician, I mean, and granted, my physician was present in part of my care team during a divorce, but she still asked me about that relationship status over time and if there are any changes. And I've seen her for 8 years. So because of the established relationship I have with her, she feels comfortable asking me questions about what's going on with my life.
And maybe because I'm 72, they're not asking. But that's a good point. Thank you.
I mean, I guess you still have your wedding ring on your finger, so there's this external sign that nothing's changed with you and your partner status, but
it's interesting.
I don't know.
But it could, even with a wedding ring.
Sure.
Right.
Sure.
Right.
And like, I don't know if it has anything to do with because like I'm like a young female. Like every time like you go to like the OBGYN, like all of my friends, we all get like the same like questions about like who we're sleeping with and like who they're sleeping with and things like that.
They ask their gender.
Yeah. Like they want to know like
So
who you're.
you would have answered yes, sir.
I just wonder if, like, outside of the OBGYN environment or being, targeted as at risk when you walk in the door because of your age and gender, who asks men those questions? Like, are they asked that routinely?
I know. I
Or
feel like
is it
just
just because
through
you
the
have a
cracks.
vagina, people assume that you have issues?
or something. Well, and but our healthcare system does a better job of asking women about their sexual health.
The only time I've ever been asked was when you're going to get married, which was 47 years ago, and you go and you have that blood test taken, and then they ask.
And I didn't have to do that before I got married in Kentucky.
Oh,
That many years. I mean,
yeah, interesting, isn't it?
in
I didn't know that was a thing.
8 years ago, right? Like,
Interesting.
I just went and got my marriage license.
Well, at least in Indiana, a half century ago, you would be tested for syphilis.
Right. So I mean, it's. I think there's inconsistencies, right? I mean, I guess that's what we're talking about. There's inconsistency. So even data that way, we don't get.
I should also mention that this question is not. It's my understanding this question is not designed to identify this particular problem. It's to identify whether or not people are asking about sexual orientation. It's really meant to identify whether people are at increased risk. This is followed up by questions on condom usage, and I think there might be a question on drug use also. So they're really trying to identify populations that historically may have been at higher risk for HIV and other STIs. So the benefits of the NSFG, it's taking a long time. You have all this sort of rich assortment of questions. You have attraction questions, this sexual behavior, sexual orientation, this doctor question. There's sort of a lot here. There's a lot of information here. And it's available back into 2002. This is only actually 3 periods of data because the data is pooled for multiple years. But you have a 2002, a 2006, and a 2010. And I would expect that the computer-assisted testing results in higher response rates or more accurate response rates relative to calling people and asking them this question or asking them face-to-face. Relatively small sample, but this limitation of the age group can be seen as both a benefit and a limitation. It's a limitation in that we don't know anything, we don't have these questions for 45 and over. It's a benefit because the sample that we would normally have that is spread out over this age is condensed into this younger age group. And so if you are really interested in this young adult population, then this is a really beneficial survey to use. We're unable to identify transgender populations. There are no questions at all on that population. And again, there's no geographic detail. I want to give one little plug here to this, this National Transgender Discrimination Survey. Has anyone heard of this? Really? So this was carried out in, I think, 2008. The publications are coming out now, but my read of the data, although nowhere in any of their documentation does it give an actual year, but I think it was carried out in 2008.
I think so, and they just finished another cycle.
And so this is a really interesting survey, a 70-question survey. They have about 7,000 respondents identified through, what is that word, snowball sampling. You know, you ask a friend, who asks a friend, and who do you know? So it's not a random sample, but this is a much more effective way of getting a good sample for this particularly small population. Their data is not publicly available. You won't find it on their website, but I would hazard a guess that if you asked them if they would share it with you, they would be perfectly willing to. I can't guarantee that, but oftentimes people are willing to share data with researchers who have a good proposal for them. Finally, I just want to say one thing about restricted use data. All the data that I talked about today is publicly available, with a few exceptions. The NSFG prior years do not have the sexual orientation, sexual attraction questions publicly available. You have to sign a data use agreement to get them. This is fairly innocuous procedure. Some other questions, some other variables that are on the surveys, all of the surveys, such as geographic detail, the state that people live in, are generally not available, but they are available usually through a research data center. So RDC is a place where secure data is housed. You submit a proposal, you pay an exorbitant fee, and then you go and you can use the full sample, not full sample, the data that has all of the variables included. And then you can take your analysis out, but not the data. And there's research data centers throughout the country. I think the closest one here is Chicago. So it's something to keep in mind if you ever have a grant that will fund that money for you. And like I said, the big reason that I would go to an RDC is to get this geographic detail, because I study spatial processes. But some other variables are also suppressed in the original data. So in NHANES, for example, they do question teen populations 14 to 17, but that data is not available publicly. So that's all I have. I actually have many more slides, but I really underestimated how long I was going to talk. So I'm not going to be able to talk today about this paper that I gave you that says descriptive statistics on it. This is a paper I'm working on with a co-author from the University of Chicago, and it's on LGBT health and race and gender and the intersectionality of these things. So individuals that non-white individuals have worse health than white individuals. Women oftentimes have worse health than men. Sexual minorities have worse health than heterosexuals. And so there's different kinds of disadvantage here, and individuals that are, say, doubly or triply disadvantaged may be at really high risk of problems. So I'm not going to talk about it today, but if you would like me to send you the paper, I can send you the paper. It's only 3,000 words. It's really short and brief, but I'd be happy to send it to you. So are there any questions that I can answer?
Well, just help me on this. Everybody else may know. What does this RH, I assume?
Self-rated health. Self-rated health.
Self-rated health. Thank you. And this has been just a wonderful presentation. Thank you.
When I see numbers of people self-reporting as LGBT or T, to me they always look low just because of the work that I do and how many people I interact with. But I think we also know a little bit about why the numbers, why it's so hard to get the good numbers on that population. Can you say a little bit about some of the obstacles in doing research and getting really good demographics on a population from historically stigmatized group?
Yeah, well, I mean, I think the numbers that we're getting now, I think they're probably in line with what the actual population looks like, at least for self-identification. I suspect that the numbers for sexual behavior are maybe lower than they would otherwise be. Because certainly there's been a stigma in the past. I wouldn't say that it's gone away. It's certainly much reduced today than it was 30, 25 years ago. I mean, it's much different. And so as these surveys continue, we're going to have these older individuals that may still be holding on to that stigma, even though it's not really present anymore. It is going to be, I don't want to say, I'll say attrition from the sample. In terms of analysis, the problems here are that there are almost certainly there's geographic heterogeneity in disclosure. So if you live in New York City, then you are probably fine to say, oh, I'm gay, lesbian, bisexual. If you live in Frankfurt, maybe not. So there's these geographic disparities, and we're not able to see them. There's also going to be differences by age. Usually we can control for differences by age. So if younger people are more likely to disclose than older people, we should actually see that in data. Right? And of course, there are going to be cultural differences, racial differences, ethnic differences in disclosure rates also. But all of these things, I think all of these things can be approached. I don't think they have been yet. Because until now, or until the last couple of years, we haven't had any data. I mean, the samples have been so low that you just say, oh, there's 40. That's great. But now we got to the point where we have much larger samples, so there's a lot more that can be done with them. So we can start looking at, well, what does this look like across the country? What does this look like among different races and things like that?
I have a question, just going back to that other slide where it was for the transgender one with the I mean, it's interesting to look at the question and look at what are the strengths and weaknesses of the question, but it's also frustrating when you're, looking at a question and looking at data, don't you just think like, oh, like what is that how can I use that data point? What does that mean if we don't even understand? Not sure that they understand the question. We're not sure that the people who are making the question understand what they're looking for. From like just a data point of view, it's like.
So from an OCD point of view, then yes, it bothers me that they're not perfect. From a researcher point of view, who is familiar with data sources and things of that nature, then you make compromises. So if someone is answering male to female, female to male, gender non-conforming, there's a signal there. So whether or not the response is exactly like it maybe had been intended, there's still some signal that you're getting from that individual that they don't identify as non-transgender.
Right.
So ultimately, you know, I'm not such a big picture thinker. I'm more of a you know, we have something here. We should make use of what we have. And like I had mentioned, you know, these questions they're changing. They're always changing. Even the N Haynes that has been asking questions over time, you know, the way that they've phrased them has changed just a little bit. So, have you ever had sex with a man? Have you ever had this type of sex with a man? You know, just these changes to get more detail about what it is we're actually looking at. So, you know, in the future, I mean, I think we're at a good point here, a good starting point, and I think in the future there'll be a lot of really useful data.
Would you imagine any of these particular surveys ever asking, you know, just in the beginning of that demographic information, instead of just male and female, asking you identify as transgender, gender nonconforming, giving other gender
Absolutely. Absolutely. And, you know, a lot of changes to these surveys, like I said, there's a political underlying, there's some politics involved. But if the national transgender community organizations were to say, do this, why don't you try this, then, you know, the survey takers, the CDC, would at least listen to that. Not saying that they would do it. But certainly I think that that's the direction that it's headed. You know, these changes, incremental. It's not going to, all of a sudden, we don't have gender anymore. It's not going to happen. Speaking as a demographer. But yeah, I think that someday that will happen. All right, well, thank you very much for being here.
Thank you so much. Much appreciated. If people would please fill out your
But answer my question.
It's good stuff. I know.
How do we figure this out?
Oh, yeah.
Will you share your paper with me?
Yes, I will. I'll send it to you.
Thank you. We keep talking about the health disparity and outreach and enrollment for insurance, but then an ACA evaluation, and it keeps coming up as the subpopulation at risk, and then it's there. But how are we going to find that out? You cannot check a box on a health insurance form that says, I'm applying as a...
I remember, well, not for that grant that we submitted a while back that Monica had, whoever had written, LGBT populations. And I'm like, in Kentucky? We have maybe 5 people that in the survey.
Kentucky Voices for Health has brought it up, and it just keeps, it does come out as an at-risk population, a vulnerable for health insurance coverage and health care.
Yes.
So, and it might have been in that country because it comes up as an issue.
You'll see in the paper that this population does have access to care is problematic for this population, more so than for the women than for the men. So gay men have reached parity with straight men, pretty much. I mean, behaviorally, health access to care, they have more money. So lesbians, bisexual women, terrible access to care. And, you know, there's obviously multiple reasons behind this. But it's definitely an avenue that we hope to go down at some point.
And so Ryan Combs is working with Kentucky Voices for Health and looking at and doing focus on qualitative research, and obviously that's pretty easy to put together. Actually, I mean, like once you're in with the community and channels, you can get people to show up at a couple of focus groups.
Right. And I think ultimately that may be how this particular line of research may have to just go. I mean, there are things that you can't do quantitatively because you just don't have the
But it would be interesting to pull some of our purpose data and look at our Kentucky purpose data with those questions, since we did have that module.
Color me shocked. Kentucky,
right?
So I don't know who made that decision, but yeah. I haven't looked at it any more than just to see which states took it, so I don't know like what the sample is like in Kentucky.
I know we have purpose data. I haven't looked at it.
Yeah. I mean, it's not difficult to get
Let's see.
because they did that module. It's on CDC's website.
Okay.
So
Right. So I know Liza pulled it, and we have it even in our phone
Right.
saved, but I haven't looked at it. So it would be interesting to look and do some of that.
yeah,
Just purpose ask about insurance.
they have to.
I don't know all the questions for that. So I mean, like that would be one way to look at it, I
I
guess.
mean, but
With insurance status.
yeah, I mean, I'm thinking, what's your lesbian and gay population in Kentucky? If the whole survey's 1,000.
Right.
I mean, you're probably looking at 20, 25 people. So, I mean, it's probably big enough to get, just if you're looking at insurance versus non-insurance versus straights, you could probably get statistical significance from that. But you're not going to look at by
Right.
race or gender or anything like that.
Oh yeah, no. Well, we know what the race is in Kentucky too,
Yeah,
right?
exactly.
I mean, okay.
Yeah.
It might not happen again. That's the problem, is that module might not ever be asked in Kentucky again.
We could figure out if it's being asked currently, because they're on the next survey. So they would have had to make that decision before.
I know.
And since if it was, you know, the state's not
Oh, you still have the
that
recording on.
conservative. Yes, I just haven't gotten to it.
I'm so
Oh, thank you for doing
As
that.
we're like talking.
Oh yeah, that's
I didn't want to be recorded.
Right.
Oh, well, there